then Anchorage. She returned to Maine and currently is an attending physician in the pediatric as well as family practice clinics. She has an interest in hypnosis and is a faculty member of the National Pediatric Hypnosis Training Institute. Today's talk is Sleep Dysregulation in Pediatrics Beyond Melatonin. Welcome, Dr. POULIN.
Thank you, Carol. Hi, everybody. I'm going to go ahead and get started. So most of you know me. As Carol said, I work in the pediatric clinic. I also had a hypnosis practice for 8 years, a private practice. And thanks to Dr. Odolini's grant funding, I'm currently doing a pilot with a hypnosis practice that's based in the MMP Portland site with very limited access, I'm learning now as I'm starting to get more busy. But at the end, I'll have my contact information and referral information. So why am I saying beyond melatonin and what are we talking about? So sleep dysregulation in pediatrics, I'm not going to be talking the medical things like sleep apnea. I'm not going to be talking about the circadian rhythm disorder. I've got nothing to disclose, no off-label uses or even on-label uses of pharmaceuticals. So the objectives are going to be to identify 3 common types of sleep disturbances in children and teens, which may benefit from your behavioral interventions. By the end, you should be able to name 3 differences between nightmares and night terrors, and to identify patients who would benefit from referral for hypnosis or other behavioral interventions. For those of you who are logging in late, CME code is 28826. So sleeplessness, why is it important? You know, we all kind of know this, but it can affect mood and behavior, attention and learning. Kids can be sleepy in the daytime, although I'll tell you they won't admit it. There can be somatic complaints that are either secondary to the sleep problems, or they can have medical problems such as asthma, migraines, functional abdominal pain, or anxiety, where sleep is contributing to it or a side effect of it. So it's important to ask about sleep even when you're seeing kids for other medical problems, because it can often be an issue. Obviously, we talk about it at our well child checks. But usually they're not coming to us because the kids are complaining, I can't sleep. It's usually the parents. So the negative effects on the caregivers are huge. The parents aren't sleeping enough hours. They're having interrupted sleep. They're having trouble at work. It's affecting stress and mood, family interactions. There might be family conflict or parent conflict about how they're going to be approaching the sleep problems. There's a lot of frustration, and that just feeds into the whole problem, and it can have some negative health effects. A lot of studies on reflex time in people with poor sleep as in relationship to job performance and driving and things like that. So these are the things that we're going to talk about today. First category is sleep onset insomnia and anxiety interfering with sleep. The second is going to be behavioral insomnia of childhood. There's 2 types, the sleep onset association type and the limit setting type. And then at the end, we're going to briefly talk about nightmares and night terrors. So beyond melatonin. So I found a treasure trove of cartoons with this Rhymes with Orange series with Hilary B. Price. The latest in natural sleep aids with a minimum of 64 sheep per tablet. Ask your doctor about Ambien. And so melatonin might help kids slow down long enough to fall asleep, but it doesn't always address the primary problem. So you can break it down this way. So taking the categories, it ends up being a Venn diagram with some overlap and some causation sometimes between the 2 of them. Because I've seen kids who dread their bed because they're afraid they're going to have nightmares. Or if they're having some behavioral insomnia, not going to sleep, it might make the nightmares and especially the night terrors happen more. So there's a lot of overlap, and those are 2 examples. So let's just take sometimes the world gives you just what you need. When I was preparing this sleep for the hypnosis, the NIFTY program, I had a version of this that had more hypnotic focus. This child walked into my hypnosis practice, and so it's a 6.5-year-old who is having sleep problems, referred from one of my MMP colleagues. She got a good history, especially in the context of it being a busy physical exam. So finds out that this child never had been a good sleeper. She had night terrors until she was 4. She's waking several times a night. And what they're stating is that she's having nightmares several times a night. They tried sleep hygiene. I don't exactly know what they did or whether or not her PCP had a chance to really delve into that, but sleep hygiene hasn't helped. She has a TV in her bedroom, which she's not using. Melatonin helps her fall asleep sometimes, but she's not necessarily sleeping through the night. So her PCP recommended taking the TV out of the room. I expect talked about some of the sleep hygiene stuff and referred to me for hypnosis. So sleep problem could mean a lot of things. It's you don't know what you're going to get when you have a child with sleep problems. So um, obviously, like I said, you're going to screen for medical stuff like sleep apnea or things like that. But talking about the behavioral pieces of it, what are your bedtime routines? Do you have a routine? You'd be surprised how many kids don't have a regular bedtime routine, and this one did not. Um, she told me that her mother doesn't let her brush her teeth at bedtime, which I was like, what? Pediatrician hat. So I talked about that a little bit. Sometimes they're watching a movie, sometimes not. So that it's not consistent. She's afraid of the dark, especially her heater makes noises. She's falling asleep in her parents' bed. That's the easiest thing for them because she's sharing a room with some siblings and she wakes them up. If they move her to her own bed, she wakes up 5, sometimes 10 times a night. And if she sleeps in the parents' bed, only once. So you can see where the path of least resistance is going to be have this child sleep in the bed, and which can create long-term problems. She had night terrors until about age 4. She's still having occasional nightmares. On the weekends, she's up late. She's playing games with her older cousins and she's sleeping until 10 a.m. So I'm delving into this. What does a game mean? I'm thinking a board game, right? Because that's what we did when I was a kid and my kids were kids. But no, she's playing video games. Excuse me, video games. What's the content? What are the video games? This 6.5-year-old is playing Call of Duty, among other games. And I don't know a lot about video games, but I know that's an active shooter, violent war game, and absolutely not appropriate for 6.5-year-olds. So I talked about that. She says she's not tired during the day, but she's having some attention issues. I don't know if that has to do with the pandemic, Zoom and disruption in school, but she's having some behavior concerns, having some attitude. I'm not sure if it's related, but there's that. So where does this young lady fit in here? So just taking a quick look at the Venn diagram. I'm looking at this and I'm finding just a lot of things to work on. She's like right in the middle. She's got it all. She's having trouble falling asleep. She's got anxiety, separation probably, but fears of things in her room. She's got probably some limit setting behavioral insomnia, but definitely sleep onset association, which needs her parents there. She's got nightmares and she has history of night terror. So where do we start? So again, I'm highlighting the things that I noticed. These are the things that I'm, you can pick 2 or 3 things to work on. If you're trying to do it all at once, it's going to be hard. And as I go through this talk, you'll have some idea of how I incorporate hypnotic language into suggestions that I make, even with a standard behavioral approach, but also how I incorporate hypnosis into the encounter. And you'll know more about that as I go on. So let's start with sleep onset insomnia and anxiety interfering with sleep. So this is usually, this isn't the real young kids. It's kind of the preschool right on up through adulthood. They have some combination of difficulty falling asleep, prolonged awakenings, because it's normal to wake up and kind of arouse in the night. But most people learn that you can go back to sleep, insufficient overall sleep, and it affects daytime functioning. So it's poor Charlie Brown. Dear mind, please stop thinking so much at night. I need to sleep. Who hasn't been there? If I go to sleep at 10 o'clock, I'll have 8 hours of sleep. Just thinking about something that you need to do tomorrow. With kids, young kids, the parents have a lot more control of the schedule. But when you have the teens, you've got this cycle of them going to bed late. They've got a lot of responsibilities. They're overscheduled. They've got a lot of homework. They get less sleep overall. They're tired during the school week. Sometimes they nap and they have weekend sleep in. Some kids will sleep until 1 or 2 o'clock in the afternoon even. And that perpetuates the, stocking up on the sleep and then starting the cycle again the next week. Screens are a huge problem. which pandemic has made quite a bit worse because the kids are schooling on Zoom, their friends' connections have been on Zoom, and there's a lot of social media platforms that they have to check one more time before they go to sleep. So, strategies and suggestions for sleep onset insomnia and anxiety. So, always for every one of these problems, we're going to talk about regular routine and bedtime. That is super important because, for one thing, if you don't have a regular routine, you don't know if you start getting ready for bed at 7, if you're going to be in bed at 7:30 or 9:30, depending on how much you're fitting in there with movies and whatnot. So it also sets up an expectation, an expectancy for the child. Okay, after I get my pajamas on, I brush my teeth, I read a book, I go to bed. Every night it happens the same. You know what to expect. Creates a pattern and an expectancy to fall asleep. You want to, as we mentioned before, limit or avoid naps and sleeping in on the weekends. So, I mean, sometimes the kids, can't function, can't do their homework if they don't have a nap. So I say limit it to 30 minutes. That's going to get you a little bit of a sleep, a little bit of rest without interfering with your sleep. But I really like to avoid napping. One of my hypnosis colleagues called napping junk sleep, like junk food as is to healthy eating. If you're going to take naps, you're not going to be tired, just like you won't be hungry if you're eating chips before dinner. So, and sleeping in on the weekends, realistically, it's hard to do, have them limit that, but 1 max 2 hours sleep in to catch up on the weekends, but no 5 hour catch ups, because that's just going to perpetuate that cycle. So caffeine, you would be surprised how much caffeine some young kids are having in their diet. I had one patient who was drinking Mountain Dew with dinner and didn't realize that it had caffeine in it. So you have to ask. Young kids are sipping on the parents' lattes, they're drinking colas, they're getting caffeine in all different ways. So you have to ask. Exercise is real important, but not right before bed because it can be activating if you exercise right before bed. So limiting screen time, we all know this. So limiting screen time before bed, you having the phone right next to your head, you're going to be alerting every time your friend is texting you or a new social media notification comes up. Lights dimmed or out. I've had so many kids come in and say that they can't sleep with the lights out, overhead lights on maybe, or every lamp in the room. And obviously that interferes with your own natural melatonin production. So dimming the lights, turning them out, having a hall light on, a bathroom light on, so you get some light coming in, night lights if needed. And so really getting them used to doing that, maybe gradually dimming or gradually making that change. Quiet activities before bed, not activating games or, roughhousing and wrestling and things like that will get them agitated. For older kids, and adults, if you have something that's just, I hope I don't forget to bring my math homework tomorrow, or something that you need to remember to do, have a paper and pen at the bedside, jot it down. You don't have to keep it circulating and ruminating in your head anymore. You can move on and do what you need to do. Okay, now I'm going to put on my hypnosis hat, and some of these you can incorporate into what you're doing as far as your counseling, and some I would say would need to have a little bit more formal training and to have some idea of how to use the language and how to incorporate it. Sometimes it's going to be a conversational approach. And sometimes it's going to be something that you would think about as being, a formal trance where your eyes are closed and you're in your imagination. So it's going to depend on the age of the child, the problem I'm dealing with, and all of that. So when I'm working with kids, I'm offering them a menu of suggestions. So I'm going to throw a few things out there, and you decide what you want. So this is the Insomniac Cafe. It's open all night, and he's ordering the tossed and turned salad with a side of melatonin vinaigrette. So invitations to hypnosis. We used to call these inductions. In NIFTY, we're kind of shifting over to calling them invitations, which is more a permissive kind of way to talk about it. Would be in school-age children and teens. And, in younger kids, you're doing more, songs, rocking, repetitive things to get them relaxed. But with an older child, you can do some more focused suggestions and invitations. So this child is demonstrating how she might practice her belly breathing. She's got a hand on her right right hand on her belly, and, breathing in, making sure that your hand rises so that you're doing belly breathing and not just the chest breathing. Sometimes I will have explained ahead of time, depending on the age of the child, the fight or flight reaction, how you're able to kind of reverse that with breathing and relaxation. So just focusing on the breath. If she's too young to really do this, or shows some reluctance to do this, sometimes bringing in a favorite stuffed animal, and like you put her teddy bear on her belly and give her teddy bear a ride up and down, and so that she's helping her teddy bear fall asleep and turn it into more of a playful thing. And then special place imagery is another invitation that to just shift in from the thinking brain into the imagination brain. So daydreaming on purpose, using your imagination on purpose, is the language that I would use around that. So sometimes these kids need to be kind of reeled into the process. They may not want to change because they're nervous about it. They're afraid. They don't want to sleep in their own bed. They don't want to sleep with the lights out. So a way that I would suggest to them, and this is something that any of you can use, of course, is that you can have glow in the dark stars or other glowing objects in the room, so that, they put them on the ceiling. They can't see them with the lights on, right? So they've got to turn the lights off to see the stars. So that's giving them a suggestion to turn out the lights without directly saying, you have to turn out the lights. In my old office, I had stars, put up stars in the bathroom, and they could go in there and turn off the light and see the glow in the dark stars, so they could sort of get the idea of what I was suggesting. There are dimmer switches you can use to gradually turn the lights levels down. There are kid-friendly clocks, and I'm not even sure which one this is, but there are ones that will glow different colors when it's an okay time, especially in the winter. If a child wakes up at 5:30, they don't know if it's time to get up because it's dark when they wake up anyway. So if you have smiley face or color, that means it's time that you can get up. There are some that will gradually dim, so that they start out with the light a little bit brighter and they dim. So there are all sorts of kid-friendly things that you can use to help you, give suggestions and to give some counseling to the parents. I love to give out these Guatemalan worry dolls. They cost about $1. You can get them at Mexicali Blues, and you can get them online. They come with either a box or a bag, and basically you can tell the child, I'm going to give you these worry dolls, and each one can hold a worry. If you have a big worry, you might need more than one. But the idea is that you put them they hold the worries, you put them in the bag, tie the top, or if it's a box, put them on the top. You can put them under your pillow, your bedside stand or drawer. If you want to leave worries home while you go to school, you can do that too. And so it gives the kids a fun way to participate, kind of, tricking them into working on this. Compartmentalizing the worries, so you can take those worries, you can put them in a box or an envelope and seal it and send it away. And I might make the suggestion, and they're gonna take that and make it into whatever works for them. But that is a way to just kind of put the worries away for a bit. The jettisoning the worries, a way to get them away, to have them not be part of you. So this young man had put his worries onto a soccer ball. So W for worries, A for anxiety, and his imagery was to kick them away. You had a whiteboard in my office. Now I use the whiteboard on Zoom for kids to draw, and so that's super fun when I'm doing the Zoom calls. So reducing worries, blowing them into a balloon, and imagine them, just releasing them and watching it go away, washing the worries away, like the words on the beach or a sandcastle on the beach. This is a book that I discovered, The Invisible String, which is a great book that talks about separation anxiety. So these two twins wake up in the night and there's a storm and they want their mom, and she explains to them that they're always attached by an invisible string, even when they can't see her. So that even if they're at school, or and then when they tug on it, she can feel it. And so that's the basic concept. But sometimes I also will do a rainbow imagery. So just imagine that there's either a rainbow attaching you to your parent, or there's there could be a one color. What color connects you to your mom? They might say purple, and then when you see purple during the day, it'll remind you of that connection, and you can imagine that at night, and imagine your mom at the other end, like a pot of gold under the rainbow. And so that can sometimes be some imagery that's helpful. A lot of kids, and I was one of them, will sometimes see shapes and imagine faces or monsters. And this young man there was a tapestry, I think, on the door outside his bedroom, and he imagined this big 10-foot monster, very specific, Big eyes, big claws. And also there was a grate in the hallway that was a 4-foot monster with a big scary face. And I can't remember what the other two little ones on the side are. Um, but anyway, this is a recurrent imaginative fear that he had. And so, I could show him something like this. And so, some of you might have seen it different ways and asked the child, what do you see? And can you see a different animal there? Oh, isn't it interesting? You can go back and forth. If you notice the on the left, that could be a beak, or that could be ears, and things aren't always as they seem. And so that can, without saying that's nuts. Of course, there's not a monster in the hallway. Just to approach it this way and get them to kind of problem solve and figure it out without directly, confronting their fears or contradicting their fears. And then when I'm working with kids hypnotically, as you would with any sort of behavioral intervention, you've got to figure out what's important to them. How is this going to help? With someone with a habit like smoking, what's going to be better? You're going to live for your grandkids, whatever. But for kids, really getting them to buy into the really specific goals that has to do with themselves. So playing sports better grades, feeling better in general, energetic and rested. Maybe your mood is better, your relationship are better. Maybe you won't be, in conflict as much with friends or parents or teachers. And there might be physical symptom reductions. And so, like if I'm working with someone with migraine headaches, your headaches will, when you sleep better, not if, but when you are sleeping better, your headaches will be better. So this young man had some imagery of the before and after. So this was before, his alarm's ringing. He's not waking up. He's tired during the day. On the right, his alarm goes off, slam, turns it off, gets up. He's bright, rested, and happy, just really showing how he is feeling as he's completing his therapy. And imagining sleeping well. And if you wake up, so generalizing the success, once you can fall asleep when you go to bed, you're going to be able to fall asleep when you wake up in the middle of the night. So that's what is important, is you're really working on the bedtime routine, and getting them in their bed is going to help with the nighttime awakenings. All right, so next topic is the sleep association type of behavioral insomnia. So this is the child who is accustomed to falling asleep with a parent, with a pacifier, with a bottle, whatever it is that child needs. They wake up in the middle of the night. The top child wakes up in the middle of the night. They've got their thumb. That's great. But maybe they need their dad or granddad there to help them fall asleep again. So getting them to transition into self-soothing is important, and to shift association to a transitional object. So, instead of an adult on the top, a monkey, a blanket, or something else like that as a transitional object. The limit setting type of behavioral insomnia. Those are the kids who can't sleep, won't sleep, they won't get in bed. All of a sudden, they've got a burst of energy. The overtired kid somersaults into bed like the kid on the top. There's curtain calls for anyone with any kind of theater experience. Who doesn't want to see this child again, right? Because they've been the star of the show all day. They're going to come out again and make a curtain call, and everyone's going to be excited to see me. And so they're popping out of bed. They've got one more thing to tell you. They got one more thing to show you. Or they might be callbacks. They're calling you to their room. They need water. They need to go to the bathroom. They want a snack. And so that's my theater version of the sleep problem, is the curtain calls and the callback. So the goals for that is going to be to increase the child's ability to settle and to fall asleep on their own. And again, you're going to have to trick this child into working on this a little bit, because it's not something that the child is coming in motivated to do if it's a younger child, which it is with this type of a sleep problem. So again, parent counseling and support. The parents need to know that their child has the capacity to change. And with any kind of these habits, if it's getting rid of the bottle or the pacifier, or getting them to sleep at night, a lot of times parents just think their kids won't be able to do it. So just giving them the support that they need, and sometimes doing some follow-up visits, maybe a longer visit to get more information just on the sleep, and then doing some follow-up visits or some check-in phone calls to just see where they're at, and then moving forward to the next step. Consistency from night to night, consistency between parents, follow through with what you've set up for interventions, very important. Having a bedtime routine, quiet activities, avoiding screen time. We've talked about all of that, turning off the lights, and putting them to bed sleepy, but not sleeping. So they need to be able to settle themselves. So when you rock a baby to sleep and put them down and they wake up and you're not there, they're going to wake up. And that goes on through to kids of other ages, that they need really to be able to learn how to self-soothe when they fall asleep and when they wake up. You want to limit interaction after bedtime. So, don't, if they're coming and they want to tell you one more thing from school, to be consistent, have them go back to bed. We can talk about that in the morning. Let's write it down, or maybe a brief conversation about it, but not to have it turn into a 1 hour long thing. One thing that can help is tickets or passes for parent interactions. Again, a child who's not motivated to do this on their own might respond to having one or two tickets, or sometimes I'll just say put two post-its on the wall or one post-it on the wall. So they get one chance to get out of bed, free card kind of. You can get out of bed, you can go to the bathroom if you need to, you can talk to your parents, get a drink of water. Um, and then whatever passes they don't use, they can save and they can buy prizes or some special trip with the parents or something. So sometimes that will be helpful. So books, songs, stories, and then hypnosis goals and suggestions. So there are so many books about sleep. I just googled and found this on one website about one bookstore, Bookaroo website. There's sports ones, there's different vehicles, construction site, trains, different characters if you're into the Boynton Bears. So you can find any kind of sleep books out there. And I usually recommend that parents, get a few so they are reading some sleepy time books at bedtime, the younger kids, of course. So this is a choose your own adventure story. The child is saying, I'm far too tired to make rational decisions right now. Can we revisit this in the morning? A reminder that you don't want this content at bedtime to be really activating. My kids, I mean, grew up not my parents, my kids grew up with the Harry Potter books. They were growing up as the characters were growing up, as the stories were getting a little more intense and a little more scary. Kids now who are just advancing through the books rapidly are not growing up with them. They're advancing quickly into some content that's more scary. So I am not a fan of Harry Potter at bedtime if a kid is having sleep problems or nightmares. And also you don't want something that's going to really just like asking them questions so that they're having to alert again. Just let them, and listening, repetition, meditative kind of books like these Star Bright Moonbeam meditation books. There's a little hint of religiosity in these with angels. So if that's not your thing, these might not be good stories for you, but parents can use them. And if they don't want that content, they could take that out and make their own stories. These are some meditation cards. The picture on the right is one that I got from one of my son's friends' Instagram posts, that she had found these cards, and they very nice hypnotic language. So the sleepy blue ocean, heavy and calm, your waters are quiet and peaceful, melting lava sliding down the hillside, you are warm, you are relaxed, you're calm. So just slowing your language, a lot of if you have make your own stories, slowing down, feeling tired, um, curling up to go to sleep, different language like that if you're making your own stories. So that was in itself hypnotic, but I'm going to put on my hypnosis hat again and talk about some other suggestions. These are they are my sleeping, my sleep buddies. That's what I used to call them, my sleep buddies. Now I call them my fomite friends because I will never be able to use them in person again in the office. But I can show them a picture of these, or on Zoom I can show them the actual animals and just ask what do you think about these animals? You're just kind of looking at them. Which one do you think would have an easier time falling asleep? And obviously they'll usually say the monkey because he looks pretty chill, he's happy, his arms and legs are loose and limp and comfy. And the bird looks pretty uptight. He might just have resting bird face, but probably just reading his body language, probably going to have more trouble falling asleep. So I might make a suggestion after I show them these two friends, just suggest that they be loose and relaxed and comfortable in their bed like this monkey's. So obviously the younger kids. pretend sleep. I might tell them a story about, myself or one of my kids, wanting to be carried upstairs by a parent and pretending to be asleep, and I would, if I'm talking about myself, I would lie on the couch and I would just kind of close my eyes and pretend to be asleep. Well, what if you were pretending to be asleep? What would you do? I would accidentally fall asleep when I did this. I mean, I wonder what will happen when just show me what would your breathing be like? What's your arms and legs? Are they moving? Are they still? Are your eyes open? Are they closed? And so, just getting, again, getting them to just slow down long enough to fall asleep. Sometimes these kids just won't slow down. This young lady drew a picture of herself sleeping. So she's imagining herself dreaming. She's sleeping. She's got an I love sleepover shirt on and her calendar. She's imagining her calendar with all the check marks for the nights that she's sleeping through the night. All right, that's a lot talking about sleep. So everybody in your Zoom rooms, take a little stretch like the monsters in the back. Nice deep breath. And this is the last topic is the nightmares and night terrors. So again, a perfect cartoon. Under the bed and breakfast, here we are, one single with meal. My arrow's not moving, there we go. So just a brief talk. I'm not going to go into a lot of discussion about the sleep cycle, but there's a difference between children and young adults. The kids, you can just see that there's a natural in and out of a deep sleep pattern. The little spikes at the top are awake. At the bottom of the troughs of the deeper sleep, the bars are the REM sleep. And so kids cycle in and out, but younger kids have a more prolonged and deeper initial sleep phase. That's why, you can pick up a child from the car and bring them in and they won't even wake up, or they could sleep through the fire alarm or things like that during that phase. So, so understanding a little bit about the sleep cycle. So young adults are more in and out of sleep, and it's more common to have a little bit of awakening in the adult population, although kids can have a little bit of awakening after that first deep sleep cycle. You can see with that little spike. So this is where night terrors happen, halfway between deep sleep and awake. So they're stuck in that half awake sort of point. So this is very different from nightmares. Nightmares are happening during REM sleep, so they can happen at any age, unlike the night terrors, which are usually outgrown by children. The REM sleep patterns of the kids allow them to have nightmares at any point. It's usually later in the night. And we'll talk a little bit more about the difference between nightmares and night terrors. So night terrors are partial waking, parasomnia, like sleepwalking, sleep talking, and they usually occur under the age of 6. They usually outgrow them once per night. And after about 90 minutes or so, the body is active, the brain is sleeping. Night terrors happen during REM sleep at any age, 1 or more per night, later in the night, active brain, sleeping body. The night terror, if any of you have seen these, they're quite impressive. Their sympathetic nervous system is very activated. They're agitated. They seem distressed. They don't seem to have any specific content or ability to communicate. They're looking right past you. They seem frightened, but you can't interact with them. They can't be consoled. You stick with them until it stops, and the child does not remember in the morning, although they might remember stories about it. Nightmares, fearful awakenings. They interact, they can be consoled, they remember the content upon awakening. So there's a difference, and kids can have both. And it doesn't matter to these parents to some extent, because this child is waking them up in the middle of the night and saying, I was in a nightmare. Okay, strategies and suggestions for night terrors and nightmares and night terrors. So again, routine, no screens, no scaries, sleep stories, books, meditations, songs. Specifically for night terrors, if they are happening frequently enough to be a huge problem, anticipating about 30 minutes before the expected time, just rousing them a little bit to interrupt that sleep cycle can sometimes prevent them from happening. And sometimes if they're having a frequent pattern, can break up that pattern. Bedtime routine is super important. Regular bedtime super important for nightmares and night terrors because they happen more frequently if there's disrupted sleep pattern. All right, my hypnosis hat. I didn't realize that I was making a hypnotic suggestion when I bought my son a dream catcher years ago when I was working in New Mexico. So you hang these on the window and you suggest to them that they catch the bad dreams and that only the good dreams can come to you. And then in the morning, the sun hits the dream catcher like the dewdrops on a spider web, and then they just disappear. So those are dream catchers. Also, you can make a huge impact on a child by letting them know that they are the boss of their dreams. And they come in to see us in the pediatric office. We're talking about something that's a big thing for them, their sleep problem, this thing that's happening every night at bedtime. And they're in a natural trance state. So they're hyper focused on what you're talking about, even if they don't sometimes appear to be listening, they usually are. So telling a child, you're the boss of those dreams, you can just change the channel to something more pleasant. And sometimes they'll just be like, oh, that can be something that just helps them to imagine that. All right, so I only actually saw this young lady twice, and I'm assuming because she's doing better, hopefully, but I do need to check in with her because she canceled the third visit. Well, her parents did. So in the second visit, I had to pick some things to work on. So we focused on the routine, books at bedtime, consistency, explained the sleep onset association, suggested they put her back into her bed. And they did all those things. I didn't conquer the fears the first visit. And she had two night terrors, which she hadn't had for a couple of years, which was interesting, but no nightmares. She was going to bed earlier and they were doing age appropriate game content. So wow, these parents were motivated and they made a lot of change. And then that visit, I read the Invisible String book, talked about the rainbow connection, did some breathing work, and then she didn't come for the next visit. So I do need follow-up. I realized this morning I should have contacted them to find out. So in summary, sleep problems are common and children may have one or more type. They can overlap. They can sometimes feed into each other. So it's really important to get a detailed history because you might hear they're having trouble sleeping or they're waking, but unless you really dig down into the details with, just specifically and especially from the patient telling me, in that case, that the heat was making noise or things like that, can really guide your treatment approach. You want to consider ages and stages, strengths and interests to individualize plans when you're doing a behavioral intervention. So, something that works for a 5-year-old is going a 15-year-old is going to laugh you out of the room or not pay attention to anything you say. So even and also even traditional counseling strategies contain elements of hypnosis. So just say, when you're sleeping better, you're, creating that expectancy, making some suggestions on things that they can do, just based on the content that we've all gone over. And that's it. I finished a little earlier than I thought I would. So there's time for questions. So there's the CME code again, 28826. And my email is pouli@mmc.org, and my referral within the Epic system is listed there. If you put AMB referral hypnosis, it'll pop in there. I actually set up to do these grand rounds when I was feeling as though I needed to fill a little more with my schedule, and I'm really only in the office like one full day divided over a couple of days. So I went quickly from being not quite busy enough to too busy. So I'm kind of booking out even until the end of the summer now. And so we're having to think about how we're going to manage a waiting list now, which is an embarrassment of riches, or a blessing and a curse, because it's sometimes you want to be able to get people in more quickly. All right. So I am going to stop the share because it's easier for me to see the chat there. There it is. Oops, that's not the chat. I want to look at the Q&A, don't I? There it is. All right, Dr. Melissa Keyport. What about middle of the night wakenings for the 4 and 6-year-old range? Due to nightmares or just No real good reason. And what about bedwetting in a 7-year-old causing nighttime awakening? I've been told you can't really train a child at this age and they'll stay dry when they're neurologically ready. But um, okay, so the child who's waking in the middle of the night, again, focusing on going to bed. That's the sleep, the just getting them to be able to fall asleep on their own in the beginning. It's hard to focus on the middle of the night stuff because you're tired. It's hard. You want to really focus on that bedtime routine. And just like that patient that I presented, that 6.5-year-old, she was sleeping, even though we weren't focusing on the nighttime wakenings, she was already had 2 nights where she had slept through the night. They were being better about putting in her bed. They were better at being consistent. And she started to have some nights sleeping through the night twice between the visits, between visit 1 and visit 2. That's pretty rapid success. Bedwetting is another whole topic. 7 and over is when I see kids for enuresis in my office. Before that, they're not developmentally ready. Sometimes they will wake up when they pee, but usually they don't, and that's part of the problem with it, is that they're not sleeping. They're sleeping deeply, and they haven't yet trained their brains to pay attention to their bladders at night. So that's a whole other talk. Um, and Melissa, when you do your hypnosis training, you learn a lot more about that. Night terrors, I think, can happen at pretty young ages. So um, I, I think they can happen even before they're able to really express what's going on. But I don't really know the answer to that. Do I have smart phrases? Feel free to look at my smart phrases, and I can talk to you offline, Melissa. I'm happy to do that. Thank you, Carol. Um, Dr. Fritz, you alluded to it at the beginning, but we frequently are referred teens with GI complaints that are closely tied to their poor sleep, especially early morning nausea. This is great to think about some steps before jumping into additional testing for these kids. I think that a lot of these kids with the early morning nausea are kids who have um, some school fears, and that could be anxiety related. So if you get a real story, it's only happening 5 days a week on the school mornings, it's not happening on the weekends, then that's a big clue. And I love to work with these kids, sometimes just explaining to them that that's a false alarm, that a lot of kids with morning nausea and school avoidance are afraid they're going to vomit in school. So there could be an emetophobia, a fear of vomiting, that's going to make it even harder for them to be able to go to school. And so, I'm happy to see those kids, and sometimes just counseling them about, gee, it's only happening on school days. It's probably a false alarm. When you get to school, usually you might feel better. And, often you've gotten that history. It can be really harder when you get into a really deep-seated school avoidance. Some of those kids really need a more intense behavioral CBT kind of approach. What other conditions do I offer hypnosis for? I would say the most common things are enuresis, tics and Tourette's, functional things like functional abdominal pain, irritable bowel syndrome. I know that in GI, there are some social workers who do have some nifty training, and so they are seeing some of the kids that are being seen in GI. I don't want to see those kids, but unless it's a really clear nausea with anxiety, I don't really want to see those kids before they've had a workup, because I have to be able to tell them, now that everything that can be done and should be done has been done, now you can focus on having more control over this. If their parent or the child thinks there's a medical thing we're missing, they're not going to be able to do this using the imaginative medicine. And so let's see, so functional abdominal pain, migraine headache, so some things that have a functional component, vocal cord dysfunction. And I'm doing some fears and phobias, although I'll have to say I've seen 6 or 8 kids with needle phobia, and of all of those, I think only one has really followed through with getting what the vaccine that they needed. So I'm having a little trouble with the follow through for those. I'm trying to figure out if I need a different format, because they take a lot of visits, and I'm not seeing a lot of success yet, which is a big hypnotic word, yet. I'm not seeing a lot of success yet. So I'm thinking about whether or not I should be saving the visits for the things that are really having good turnaround and good results. Dr. Heather Daigle. Have you considered making a version of this talk for parents that could be recommended for them to watch for more details info if they bring up sleep? Or perhaps one of many concerns during a well-child visit or another visit. That way they could start to implement some behavioral changes prior to a visit with you. I have not thought of that. A good thought, but I haven't done that. Heather, maybe we can work on that together. Thank you, Dr. Chan. Allison Layton, could you try to wake a child? Should you try to wake during a night terror or just wait it out and comfort them? Yeah, you can't wake a child in a night terror. So you just have to kind of wait for it to pass. It's, same thing with, if they're sleepwalking, you're not going to be able to alert them, but you want to make sure that they're safe. And so, it can be really distressing for a parent to see that. But when you understand that, that it's happening on a subconscious level of me, or they're not going to remember it at all. It helps a little bit. So yeah, I am very welcoming to questions. If you want to email me, if you have a question like, is this child appropriate? Are there other things that should be done first? Or anytime you have a question about this, again, like I said, I'm hoping to be able to expand my hypnosis hours, but I'm not sure how easy that's going to be. Hopefully that'll happen. So, any other questions? You're welcome. All right. Well, if there's any other questions, like I said, feel free to contact me. And like I said, you can do a lot of this work yourself. It really just involves setting aside some time and getting a real detailed history, giving the parents the tools that they need, giving them the support, and just telling them that you can do this, and having some follow-up visits. Because if you don't have some either phone check-ins or some follow-up visits, if there's something that's not working, you're not going to know. And melatonin is great, helps you slow down long enough to accidentally fall asleep, but it doesn't really deal with the core problems in a lot of these cases. So that's why it's beyond melatonin. So, all right. Well, thank you for coming, everybody, all you faces out there that I can't see. And I think we're going to end a little bit early. Bye, everybody.
Thanks, Eileen. That was great.
You're welcome.